Hello, everyone. Thank you for joining us. Welcome to the Y&E podcast, and we appreciate you stopping by to watch our content. And if you haven't subscribed, make sure you subscribe, like, share, and engage us in the comment section. We want to hear from you. Let us know what you think in the comment section. We have a topic we want to discuss, and it's about the statement that Mr. Femi Adesina made during his interview on China's TV about how Buhari would have died a long time ago if he stayed in a Nigerian hospital. So we want to, give our takes on this statement. And this is definitely um, a testament to how out of touch the Nigerian leaders are with the people. They don't really know the struggles of everyday Nigerian. An average Nigerian is his own security. An average Nigerian is his own PHCN, his own NEPR. They generate their own power. They provide security, something that the government should be providing. Even the healthcare, right? Healthcare in Nigeria is basically next to nothing. If you don't have money to go to private institutions or private hospitals, you're not going to get the care you need. But if you have the money to go to private institutions, you will definitely be taken care of. Whether or not the private hospitals do a good job, I don't know. Maybe that's why the president was flown out to be attended to in the UK. But the government of the day can provide with good supplies of medications, with good supplies of equipment that can take care of any and all sicknesses. And this shows that a lot of our leaders are really out of touch with the people. Because if they are not out of touch, they should be the one cheerleading this effort. They should be the one making sure that every Nigerian, no matter their location in the country, they have access to good health care. Since they're focused on doing other unimportant projects, since they're focused on finding a way to do elephant projects to siphon money off of, they're not going to want to do the healthcare. Healthcare should be essential. It's an essential thing that everyone needs to have access to. We don't have a world-class hospital in Nigeria. I don't think in any region in Nigeria. If the government can at least build a world-class hospital in each region and then provide good doctors, provide enough resources to go around, it'll be a good thing for the Nigerian people. Whoever does it, whether President Tinubu or the next president coming in, they'll be remembering the good books. And we can see how a lot of people felt when President Buhari passed. I mean, these things will keep continuing until we have a permanent solution to the issues of everyday Nigeria. Healthcare is important, and a lot of Nigerians need to be provided the means to be able to access good healthcare. Even if they don't have the money, even if they can't afford to go to private hospitals, they should still have that opportunity to be taken care of. They should have the opportunity to be seen by a qualified doctor. What do you think?
Yeah, I truly agree with you. I think the statement he made it out of ignorance, and he did not really think it through. And I think that is disrespectful to Nigerians by him saying that if the President Buhari had stayed in Nigeria, he would have been dead long time ago. I mean, that is indictment on the leadership of Nigerian leadership from Obasanjo down to Goodluck Jonathan and up until Tinubu. I think all of them have failed the people. I think right now we should be talking about solution and to ensure that this doesn't happen again. The idea that our leaders continue to die abroad, they are born here, they make their fortunes here, they meet all their careers, aspirations, their goals, everything they meet them here. And then during their final days, they go and die abroad, and they bring them back as a cargo. I think this should be the last one that we'll be experiencing with this. That statement is disrespectful, and I wish Shenwu had asked him follow up question to really elaborate or expatiate and explain further what he meant by that statement. Does it mean that the healthcare system in Nigeria is nothing to write home about? Does it mean that his boss wouldn't have been guaranteed protection? Maybe his information would have been sold. Maybe people would have gone out with his medical information. I wish Shehu had asked him, follow-up question to really explain himself. However, whatever his motive is for that statement, I think he should withdraw that statement. He can always deny the statement, even though he's out there in the public domain. He can always deny it. and said that we Nigerians are quoting him out of context. I think that would be much more acceptable. Making that statement is height of irresponsibility. He shouldn't have made that statement. I know that emotion is flying. The somebody died. His boss just died. I think he's probably emotional. He's shaking. But if he could have told Shehu that he wasn't in the right mood for interview instead of going out there to make blunders like that. I think moving forward, political appointees, politicians should watch their statement. Some of those statements can be very inciting.
Yeah. And it looks like they're really, really out of touch with everyday Nigeria. And they need to be looking at a way to make the lives of Nigerians better. And like I said, if you don't have money to be able to take care of yourself in a private hospital in Nigeria, you will be left unattended. And the current government hospitals that are available, they are underfunded. They don't have all the resources that they need to take care of cases, health care issues like leukemia and other life-threatening emergencies. And if the government can make room for these things, I know some of the hospitals are really old and they are very outdated. The government can build new hospitals. If they can't build new hospitals, they can invest in existing hospitals. If they can't invest in existing hospitals, maybe they need to work in partnership with private hospitals and find a way to help Nigerians, find a way to make sure that they have access to good health care. But no, they're busy doing something else. They don't really care about it because they don't have to use the healthcare system. In fact, many of their family members are not in Nigeria. They live abroad. They have access to good healthcare. So they really don't have any incentive to take care of the people. They don't have any incentive to provide good healthcare, especially if they're not running for office. Even if they're running for office, they know they can induce people when it's time for election. They can induce people with some money to get what they want, to get their vote. They can induce them with food, a couple, not even a bag of rice, right? They can induce them with food supplies and things like that so that they can get their vote. So they know how to work the system. The politicians know how to work the system, but the people haven't figured out the politicians. So maybe when the people figure out this is how the politicians roll, they can have a better strategy to at least either hold them accountable or call their bluff whenever they come out looking for their votes.
Yeah, that's correct. The politicians know how to work the people, and then it's unfortunate that the people don't know how to work the politicians. And the funny thing, the most funny part of this is that they divide us. They pitch us against each other. We, the poor, they pitch us against each other. And when you go to Twitter, people are fighting over ethnicity. Yoruba is fighting Hausa. Hausa is fighting essentially everybody is fighting each other. And if you go to Twitter, you'll be seeing some tweet like, some section of the country did not come and pay homage, pay their respect to Buhari. The North will definitely remember this when the election comes around. I bet you people are sitting down somewhere pushing this tweet, pushing these narratives. And then before you know, all of this narrative will play into 2027. And, they will use it, they will run with it and win an election again. So I really support your idea of private partnership with the government. They can build, like I said before, they can build these hospitals and then hand them all over to private sector. Maybe they can lease it out, or maybe they can give it out to them to manage for them. In order to be step away from the picture, because government has no business running business. They have no business in business, and they are very terrible in running business. Even though they want to be in business, they don't know how to run it. And the government, especially Nigerian government, they lack maintenance culture. So if they end up building hospitals, they may not be able to maintain it. That is the situation of some of our infrastructures. There is no maintenance culture. If you go to some of our landmark infrastructure, there is no maintenance culture. Everything is falling apart. So it makes sense to give it out to private organizations, either to manage or to lease to them. They operate it, and then the government can in turn, subsidize the healthcare for the citizens. Anybody go there and then get, treated for whatever, issue they have and pay some, maybe flat rate, or maybe depending on what kind of treatment you get, they can charge you based on that. So I think that is a very good idea. That is probably one of many solutions to this. And I also think that, for the fact that on the street that, people are saying that Buhari died of leukemia. I think it would be a good way to immortalize him or as a memorial across the 6 geopolitical zones, build a modern standard cancer treatment centers, in to honor Buhari. I think that will be another thing for the federal government to consider.
Good idea. Good idea. One question I do want to ask: what is the job of a minister of health in Nigeria? A minister of health should be working in conjunction with all the commissioners of health in all the 36 states, whether they're in the same political party or not, right? Basically, their job is to ensure that the people of Nigeria are taken care of. So I don't know what they do in the Ministry of Health. I don't know how they've been managing the resources in the country. I don't know what they can do to fix some of these issues, but the healthcare definitely needs some attention. And hopefully the Minister of Health is out there listening, because it's their job. It's the ministries of health job to take care of the people, to take care of to have an oversight on the health system of the country. And if the health systems are not working, maybe they need to develop new systems. They need to find a way to make the existing system work or build a new system entirely. So what do you think the job of a minister of health in Nigeria should be as we wrap up this section?
Well, like you explained, I think ideally they're supposed to be coordinating with their counterparts at the subnational level, coordinating with them, making sure that they're taking care of all these hospitals, maintaining them. If they need more hospitals, I think they build more, equipping those hospitals with whether it be with medical supplies and basically for whatever they need. I think that is, actually what their job is supposed to be. And in the world of psychophancy, everybody is a sycophant in Nigeria. Everybody is trying to play to the gallery. And for the fact that, these people have no need for our medical system, they fly abroad, they go abroad for their medical checkups and stuff like that. So if it doesn't benefit them, they don't see the reason to put it up. So I guess that is essentially what is happening. And they don't know that one day something may come up that will they probably warrant them to use it to stabilize them before they are even able to take them abroad. I always reference Wike when he was the governor. He said he got sick, in the middle of the night, and then they had to arrange for a private jet to, take him to Lebanon to treat. And that is probably the most stupid thing I've ever heard. You're the sitting governor, you don't have a hospital that can take care of you. And I also think that, the Ministry of Health and the Minister of Health, and they should, get tough on, patients' information. If somebody come to your clinic or to your hospital to do a test or to do something, it shouldn't be out there in the public domain. Their health information to remain with them until they authorize you to give it out to somebody. Otherwise, you will just they just have to keep it secret per se. They just have to keep it secret. You can't just be going around and be running your mouth about somebody. Somebody come and conduct HIV test and the person end up being positive and you go around running your mouth. That is why I like this place, because you can get sued, and then even as a medical practitioner, a nurse, a doctor, you could lose your license for that. Yeah, I think the federal government need to get tough on that as well. I think that is what is really prompting. I'm just playing the devil's advocate. I think that is what is really making these politicians and then these are big men to choose abroad over this place, because they don't want whatever that is wrong with them to be out there in the public domain.
Okay, yeah, that makes sense, and that's part of the job of the Ministry of Health. They need to make sure that the hospital workers are held accountable and their private information is not made public. Their healthcare information is not made public. Doing a quick Google search, it looks like we have two ministers of health in Nigeria. Don't know what the job is. One person is a coordinating minister of health and social welfare. Another person is the honorable minister of state for health and social welfare. And this is the fact. This is the fact, the president should have cut. This is the fact that they need to be trimming. But it's unfortunate that people are rewarded based on their loyalty to the presidency, based on their loyalty, not to the country, but to the person and the seat of power. I don't understand the job of two ministers. basically doing the same thing or doing something similar. They can combine these positions and eliminate one position to save money. Like you said, the government don't have any business running business. Yeah. Hopefully they both of them can come together and figure out a way to make healthcare accessible to every Nigerian. But until then, they need to figure out what's going on. How can you have two ministers in one position? I can't figure it
Yeah,
out.
that's not the only ministry. That's actually not the only ministry. Ministry of Petroleum. They have a minister of petroleum. When Buhari was alive, during his administration, he was the minister of petroleum, and he made Ibe Kachuku the minister of petroleum for state. And Tinubu self is actually another minister of petroleum again as well in this his administration. And I think somebody from Bayelsa is a minister of state for petroleum as well. Those are the two ministries now that I know that they have two ministers each.
Yeah. Fact like this should be caught, and Nigerians need to be talking to their people. They need to be talking to their leaders and making sure that fact like this is caught, is streamed, and the money, the resources is funneled to the right channel that can help the people. I don't know how two ministers helping the situation of the country. It looks like nothing has changed so far. Whatever they're doing is not working. So they need to figure a way to make it work.
All right. If you have opportunity to japa, please japa because these people are playing games with your life, and that is all I have for you. Thank you for staying with us.
All right. Thank you. If you haven't subscribed, don't forget to subscribe, like, share, and join us in the comment section. Should we have two ministers in one position? Should the ministry be held accountable for not providing good quality healthcare for the people? So let's hear your opinion in the comment section. Thank you very much for joining us and have a good day.